literally this is the medical officer's tablet tin, and basically contains all sorts of things such as, can't really see actually, cocaine there. There's lots of morphine in here, morphine tartrate. There's strychnine, procaine. Procaine's basically. So Major, what's procaine for?
Cocaine.
Procaine.
Procaine.
Yes.
Procaine will be an opioid, so it'll be the same as cocaine, probably on a lesser dose, lesser strength dose. Cocaine being 100% pure.
Yes. And all sorts of other.
They just mix these up with.
What they do is they titrate it with distilled water.
Yes.
And
then inject.
Emetine is purgative, isn't it? Vegetative.
Yeah.
I don't know how you can read that writing. It's
tiny actually, yeah.
Emetine is an antiemetic.
Right. What else is there? Procaine again. Procaine. Morphine tartrate. Don't know what that one is.
What you do is you titrate this into water. So you'd mix it like so it would be 10 mils of water, and you would titrate it so you had 1 milligram per mil.
Okay.
So if you wanted 10 mils or 10 milligrams, you'd have to titrate it so there was 1 milligram per mil of fluid, so that you didn't overdose the patient. So you give an initial dose of, say, 2 milligrams, which allowed you to have 8 milligrams to play with to steady the pain in the patient. If you give them too much, it becomes a respiratory depressant, and especially with head injuries, it can cause serious side effects for head injuries.
Yeah. And what are those little packets, tiniest ones?
These ones here, again you've got things such as cocaine there, and that one is, can't read that one, that label's gone.
Thanks.
Again, it's quite difficult. Again, more cocaine there.
Yeah.
That one is, can't actually quite read that one. I don't know. Again, these are so difficult, they're so minute. Atropine there, atropine being distilled from deadly nightshade.
Oh yes.
So atropine. There's some, what else is there?
So really, if you're short-sighted as a surgeon or a doctor, it's a huge advantage.
Yeah. And there's adrenaline there as well. So,
okay.
Yeah.
And those pieces there?
I'm not sure what those are.
It looks like padding.
Are they the chloroform?
These could be actually, quite often you'll get chloroform in little things. You just break it, and then if you want to evacuate a chap out of a tank or an armoured vehicle, they quite often just anaesthetise them just to pull them out because of injuries.
I see.
Or they're horribly burnt. They'll anaesthetise them and then pull them out.
Right.
And so then these can be just broken and then
course.
inhaled.
So there's a bottle and a tiny bottle inside that.
Yes, you just break. Yeah.
Excellent.
Just inhale and then.
Really good. Yeah. Oh, thanks so much. I would never have known.
Yes. And in the end here you've got again minute.
The devil's in the detail, isn't it?
Yes. You have 2 camel hair brushes, so when you get the tiny little tablets out, you can brush them aside.
Yeah.
And then a tiny pair of tweezers as well, so you can pick them out.
Fascinating.
Obviously would be lost quite easily.
Yes. So do you guys do talks on these things, or if people want to know?
We can
do.
do.
These events, yeah.
Yes.
Yeah, but I mean, I have done school visits as well. So
Yeah.
yeah.
Oh, that's excellent.
It can be done.
Right.
This is morphine tartrate,
Yes.
which is the standard pain relief which is used. Lovely warning on here. Warning, maybe habit forming,
Yes.
which is great. In here you've got sterets. Each steret contains. You can hold that.
Never seen anything like that.
Each steret contains a quarter of a grain of morphine. Take the top off, push the wire down, pull it out, and you've got a needle and a syringe.
And that would be a dose for one person?
Yeah, one person.
Yes.
You literally, into the wound, squeeze,
Ooh.
and then mark the man's head with an M for morphine. So when he gets taken back to the chain of evacuation, then you know he's already had morphine. So
I
it's
see.
in a prominent place.
What, with pen?
Yeah.
Special pen?
Normally iodine or grease pen.
Really?
So, yes.
Okay. Wonderful.
That's how they work.
And what are these things over here? What poisons and things?
Chloroform, again, your standard anaesthetising agent. In parafield ambulances, parachute-filled ambulances, the way we anaesthetise people would be using chloroform or ether or sodium pentothal, which is the truth serum, but use it enough and then you can anaesthetise people with it. Basically, chloroform depresses the heart, so it's kind of frowned upon by this stage to use it. And also chloroform has the disadvantage that it's quite explosive. And so if you've got a sterilising area with naked flames and you've got chloroform floating around the dressing station, it can be quite explosive. So sodium pentothal was quite often used. It was mixed up beforehand. You know, you'll have a bottle like that, injection straight in, and then off you go.
Hey. And what's in this big box?
That's Novatox. That's basically local anaesthetic.
And it's perfectly all right for you to display all these to people?
Yeah, fine.
That's brilliant.
A lot of these ones don't have the original medicines in, and they've been replaced with other things. So, such as the morphine isn't true morphine
really
anymore, because if some kid got hold of it,
yes, quite high street value.
Yes, exactly. Yes.
My word. So these medicines wouldn't go into a kit bag like that one there?
I normally have them in a pannier, such as that there, or
that green.
Yes, green.
Yes.
We have different sections for these things, or they'd be on the chap's medical officer's person.
Yeah, I see. Now that wheel with a big contraption, is that for dentistry?
It is, yes.
Okay.
I don't know where my dental officer is at the moment. He's around here somewhere. But, he's gone off somewhere, but it's all basic stuff. It's all literally various different types. I mean, this is my specialisation, and so the dental officer will talk to you more about that. But as far as I'm aware, these are things. This is the Army pattern dental set, which consists of various different types of extractors. This thing is rather like a screwdriver. It's for elevating when you've actually taken it out. It's actually for elevating the thing out.
Elevating the tooth so you can.
Fantastic! I have my dental officer here.
Then use the extractors, depending on where in the mouth the tooth is. Using one of these nice extractors to extract the tooth with the elevator and pull it out.
I was just talking about the drill. I'm sure you can talk more about the drill. I don't know anything about it.
Is this Second World War kit?
This is all from about 1944, so this is the kit that would have been issued in 1944.
This drill here is 1944 dated. It's
actually, yeah, it was issued in 1944.
Great.
And obviously this is a portable dental foot drill. It actually packs down. To this case here, quite convenient for the dental officer in the field. And dental orderly working the foot drill, and myself carrying out any dental work in the patient's mouth. Very nice. Totally self-reliant. It doesn't require batteries, an engine. It just requires someone with a good foot power to keep it going.
Obviously, the whole thing with airborne forces is that you have to overcome, you have to make do and carry on. If the kit doesn't arrive, or it gets sent to the wrong place, or gets forced into the wrong hands, then you've got to make do. At Ireland there was a medical officer called Mawson. In his surgical team, the amputation saws didn't turn up. They got lost somewhere, I don't know where. But each man was carrying a escape hacksaw. This was sterilised up, a pair of Spencer Wells artery forceps on one end, wire on the other end, and those were used for amputations. It worked, you know. It's so it's the way of it, really. Obviously, in the field, we would be taking tentage in with us. We'd be taking over a school, a hospital, some sort of building which had cover. Obviously, there's no, you wouldn't have the space or the inclination to take tents with you. So